February is Heart Health Month. Hello and welcome to 18 WJTS in.form. I'm your host, Bill Potter. Joining us through a Zoom call is Chelsea Brewer, the Health and Human Sciences Educator with Purdue Extension, Du Bois County. And we're going to talk about some things that you can do to prevent heart disease, to know what heart disease is, and maybe some risk involved, possibly some other things as well. Chelsea, welcome to the show.
Thank you, Bill. I'm glad to be here.
Well, we want to, first of all, I guess the best thing to start things out is what's considered heart disease.
Sure. So for a muscle that's about the size of your fist, our heart performs some very, very important functions for us. Obviously, it pumps our blood around our body, and that oxygenated blood is what keeps us happy, healthy, and functioning at our full capacity. So heart disease is any condition that involves the heart or blood vessels. Atherosclerosis is the blocked arteries leading to heart disease. So when plaque builds up on the inside of arteries, it causes the arteries to narrow. Can you see that okay? All right, so here's our normal artery. And as you can see, we're starting to get tiny little deposits of plaque, and that is restricting our blood from flowing through. The difficulty that this creates for our blood flow is what eventually results in a heart attack or stroke, and over time can weaken the heart muscle, causing our congestive heart failure that we hear about, which is essentially the heart muscle weakens and it can't pump that blood properly anymore. There are two general categories of risk factors: controllable and uncontrollable. So first we can talk about those uncontrollable risk factors. There are four of them. It's family history or our genetics, our age, race and ethnicity, and gender or sex. So family history plays an important role in our risk for heart disease. And if our parents or our siblings have any heart disease, it's important to note that at your doctor's appointment so that they can monitor you for any risk factors yourself. But it is also important to note that your risk doesn't necessarily increase if that parent or sibling had their own uncontrollable risk factors. So if they were somebody who didn't have managed diabetes or was a smoker, we'll talk about those later. Age. Dun, dun, dun. Age, unfortunately, is a natural risk factor. Plaque just naturally accumulates in our arteries. And so as we grow and go into our best years, that accumulation mounts. We have seen studies published where children in elementary school are already showing signs of this plaque buildup. So that's why it's so important to consider our diet even for children, because unfortunately, it's a process of nature and it is going to happen. We just want to kind of lessen it. Race and ethnicity, as well as gender and sex, are also risk factors. We know that heart disease is the leading cause of death for both men and women. However, women tend to have different symptoms than men and a higher rate of mortality or chance of dying from heart disease. So definitely something to consider. Now, those controllable risk factors that I said we would talk about later, there are quite a few of them. And controllable just means it's related to our lifestyle or things that we can kind of manage ourselves. You can't manage your family. You're born into that, good or bad. You can't manage your age. That's just something that's naturally going to happen. But these risk factors are something that we have a little bit of control over. The number one risk factor for heart disease is hypertension or high blood pressure. So it's often called the silent killer because there are no symptoms. That's why it's so important to monitor your blood pressure and know what a normal range is for you. So an average blood pressure is 120/80, but you definitely should talk to your healthcare provider and see what your range is and call them if your blood pressure ever falls outside that range. There are a lot of different ways that you can monitor your blood pressure, whether it's through a home machine or places like pharmacies or drugstores have free machines. You go in, you stick your arm in, it squeezes super tight and you get your reading and you're done in a few seconds. So it's always recommended, especially if you have had high blood pressure in the past, to keep a log and keep track of that so that you and your healthcare provider know what's going on. Another controllable risk factor is cholesterol. Another risk factor that has no symptoms. So important to go and get your annual exam with the test to see where your cholesterol levels are at. That's the only way to know. You can't feel high or low cholesterol. You don't know inherently where it's at. The next controllable risk factor is weight. So your weight is another important number to know, and not just what the scale says, but your BMI or body mass index. That is a ratio used to screen for weight categories that may lead to health problems. So if we find that we're falling in the overweight or obese ratio categories, it increases our risk for heart disease. A heart healthy eating plan is the best way to affect our BMI and lower it. So that includes a variety of fruits, vegetables, whole grains, lean, healthy proteins like beans, nuts, fish, poultry, and trying to avoid saturated fats, trans fats, foods high in cholesterol, high in salt, or added sugar. It is important to note that if you have diabetes, you need to keep those sugar levels under control. About 2/3 of people with diabetes actually die because of heart or blood vessel diseases. So that is a major complication of diabetes. The next controllable risk factor is physical inactivity or lack of exercise. Okay, we all know we need to exercise more. Regular physical activity is a powerful way to reduce our heart-related risk factors. To make physical activity more enjoyable, choose something you like to do and try and break it up into small chunks. So for an average adult, it's recommended to get 150 minutes of moderate activity. So that's where I can talk, but maybe not sing a song while I'm walking or riding my bike, whatever I'm choosing to do. But we don't have to do that 150 minutes all at once. You can break it up into small chunks, say 10 minutes, 3 times a day for 5 days. You've got your 150 minutes. And as long as your heart rate goes up, it counts towards that total. So if you've got a 5-minute break, get out there, walk around the building a few times, count it. The last risk factor that I want to talk about today is smoking. The best thing you can do for your heart is to decide to make the change and to quit smoking. People who smoke are 6 times more likely to suffer a heart attack than non-smokers, and that risk increases with the amount of cigarettes that you smoke in a day. So that 6 times more likely is a 1 cigarette a day person. If we're talking 1 pack, that risk is much greater. Okay, so there are many resources available for when you choose to make the commitment to quit. Contact your healthcare provider and they can help you find the best choice for you. Of all the risk factors we discussed today, high blood pressure, high cholesterol, and smoking are the 3 biggest factors. Nearly half of all Americans have at least one of those. So that's why we're seeing 1 in 4 deaths being from heart disease.
Well, I think years ago, and I can say this because I'm older, access to having that variety of food that you need, fresh fruits and vegetables, was always a little bit of a challenge because they weren't always available in the grocery store year round. But now it seems like you can always find blueberries fresh in a grocery store at a reasonable price. I don't care what time of year it is. So it's a little different now, because now that is available to us, we need to make sure that we take advantage of that, because we obviously can't do the uncontrollable things we can't stop, but the things that we can control, eating right, as you mentioned, exercising, and quitting smoking, things like that can really, really make a big difference. And it's not too late to start those sorts of things. I think with COVID-19, we have maybe heart disease may have taken a back seat in people's minds, where it's still the #1 killer, is it not, of Americans? I think
It is.
Okay, so it's the #1 killer, and it also, COVID and heart disease together will kill you. But it's not something that you should put aside going, okay, well, right now I just got to deal with this COVID thing that everybody's talking about. No, we need to make sure we keep that at the forefront too. And I'm glad we did this show on that, so people keep that in mind.
Yeah, it doesn't go away. It doesn't just hide in the corner because big bad COVID came in the room. I mean, heart disease is here, and it's bullying us, and it's taking control of our lives. And to talk about your point of fresh fruits and vegetables not always being around, frozen is just as good. Some canned is just as good, as long as we watch the salt.
Yes.
Right. Yes. So maybe you can't afford the huge markup on strawberries right now, but you can go and get some frozen ones, make a smoothie, and still get a lot of the same vitamins and minerals that we need.
Okay. And is there anything else that you would like to add about Heart Health Month of February?
Sure. Yeah, so if you find yourself having any controllable risk factors for heart disease and you're ready for a change, reach out to your healthcare provider, come up with a plan, and then search for a class in the community to get started on setting your Heart Smart goals. We're always here, and we're always happy to help.
And there's plenty of those opportunities around. Either you offer it, or the hospital offers it, or somebody offers those kind of programs to educate yourself more about heart disease.
Absolutely. There's always somebody somewhere who can help you discuss things in your life that maybe are contributing to these risk factors, and to help you set those goals to make the changes.
Chelsea, thank you very much for being our guest and talking about Heart Health Month, February, in this time of a whole different way of looking at illness and disease that we have going throughout the world. Our guest has been Chelsea Brewer, who is the Health and Human Sciences Educator with Purdue Extension, Du Bois County. We certainly appreciate you taking the time to talk with us through Zoom, and we thank those who have watched 18 WJTS. We are local people watching local people.